uh, safe and healthy practices. So this is just a, a show of what we expect or how you can have healthy practices during your menstrual periods. Practicing good hygiene, such as washing hands before and after handling menstrual products, can help prevent infections and ensure overall sexual health. Uh, just the same way we're discussing the menstrual products, we are now here discussing uh, the use of menstrual products and how safe one can use these products. And we're just giving an example of how to use pads by placing them underwear and change them regularly. For those individuals who are working in societies or in schools with young girls, especially those adolescents, but also teenagers who are in their puberty stage. This information is very important when you're teaching or when you're impacting knowledge into them, how to properly use these menstrual products. Using tampons properly, insert into the vagina, change every 4 to 8 hours to prevent infection, and use the lowest absorbency that is needed. To use these menstrual cups, and this is just an explanation of how you can use these products. I think we cannot dwell so much on them because they are very understandable. Uh, Understanding the menstrual poverty. Now, menstrual poverty refers to the lack of access to menstrual products, adequate sanitation facilities, and menstrual health education due to financial constraints. Many of our societies, especially in Africa, many of our young girls are suffering from this term being referred to here as menstrual poverty. Many of our girls do not have the menstrual education, or they don't have information regarding how they can have a menstrual hygiene. But also, many of our girls do not have the money or the financial muscle for buying menstrual products. And it is very key, and it affects very many young girls. It is another cause for high teenage pregnancies because many girls would want these products, and the only people who can offer them want to offer to them on a cost. It affects individuals who struggle to afford or access essential menstrual supplies. Now, I've just given you a brief of some of the negative consequences that occur as a result of menstrual poverty. What is the impact on education? What is the impact of menstrual poverty on education? It can hinder education, particularly for students who may miss school days. This is due to lack of menstrual products. Because an individual does not have a pad, then there are chances that the girl may not come to school or will miss a few days when they start their menstrual cycle. Absenteeism and academic underachievement is also another cause, is also another result of menstrual poverty. And this is because uh, individuals, because of the stigma that comes with from boys regarding menstrual poverty. Many girls decide to remain in school at home during their menstrual cycle rather than going to school because they do not have the pads to wear as they go to school. The impact on health and hygiene. Inadequate access to menstrual products can lead to unhygienic practices, increasing the risk of infection and reproductive health issues. So, being having menstrual poverty, this may be in form of not knowing, not having knowledge regarding how to keep a hygienic practice, and therefore, because you're poor, with you don't have the information that could keep you healthy, you're are subjected to a lot of unhygienic practices which may cause infection. Likewise, limited access to clean water and sanitation facilities exacerbates these challenges. That is why there is a very big project on WASH in majority of the health systems, because sanitation is one of the key preventive measures of diseases and morbidity in the society at large. And therefore, it is very important that societies have access to clean water and sanitation facilities. These include garbage pits, these include washrooms, toilets, and in these particular facilities, there needs to be clean water. Therefore, when you see, especially for our colleagues who are living in camps today, this is a very big challenge, because access to water is not is very limited, and you may not get clean water very easily. And therefore, wash is a very, very important feature in menstrual poverty and managing menstrual poverty. Another impact is economic, and menstrual poverty reinforces gender inequalities, and it perpetuates social stigma and taboos surrounding menstruation, because someone cannot afford money, because a girl does not have money to buy a pad, then the man is the one who looks at himself as superior. That is where the gender inequality comes in, because I am able to have the money to buy a sanitary pad, then the girl or the female gender is underlooked down because of this. But also, it increases social stigma and the taboos that surround menstruation. After all, it is the man or it is the male who will provide for you. And therefore, during your periods, when they claim that you may be encroaching on their budget, uh, the stigma or the negative thoughts of the community on menstrual periods continues. Uh, the same thing I have said here in terms of burden, and I have explained the lower point already. Uh, Addressing menstrual poverty. What are the key strategies for addressing menstrual poverty? Menstrual products need to be provided unto to the women or the females or the girls in schools, especially, but also in the community. This is how we can tackle menstrual poverty. NGOs or government policy can ensure that access to affordable, free menstrual products is there. And how does government or NGOs ensure access? Government can subsidize costs related to manufacturer, most times through maybe uh, giving tax holidays to uh, industries or factories that make these sanitary pads. So if government is able to subsidize some of the costs, then it will help in the access to affordable menstrual products. But also NGOs can take up the mantle through giving budget allocations for the supply of these products. Menstrual health education is another key component we can integrate in order to address the key issue of menstrual poverty. Promoting comprehensive menstrual health education in schools and communities to break stigma. Sanitation infrastructure through improving access to clean water, sanitation facilities, but also we need policy advocacy. We need to advocate for policies that recognize menstrual health as a right, and we need to also advocate for policy that helps to reduce social stigma associated to menstrual cycles. Collaboration among governments, NGOs, health providers is also crucial in addressing menstrual poverty. Public-private partnerships can support sustainable solutions that include donations, but also campaigns, infrastructure development, and we have seen this in very many societies that the NGO world and our government, but also private entities, are offering support to sustainable uh, to have sustainable products. For example, we are seeing in some schools there has been support on the construction of sanitary facilities. We've also seen worldwide organizations like UNICEF that directly look at children, construct wash facilities that help in improving access to safe and clean water for young girls. What are the global efforts and success stories? We've seen several countries and organizations take steps to combat menstrual poverty, which I have just talked about. For example, UNICEF, we can see very many projects that they are doing. An example is also the Scotland's provision for free menstrual products in schools, and in New Zealand, implementation of free products in schools and colleges. But also, non-profit organizations like Days for Girls and the PAD project have also made substantial impacts through their initiatives. So, what is very key is if you would want to know how this effort or these projects have impacted the society or have impacted uh, the girls in terms of their menstrual hygiene, it is very key that you go after this and just take a look at the Days for Girls project and the PAD project. When you read their success stories, you will be able to have a clue of how very important menstrual hygiene is in improving the quality of life of our young girls. To break the menstrual poverty cycle, we need to empower individuals with knowledge. For example, you who are now learned or who are learning sexual health now understand how important menstrual hygiene, but also how it affects public health and an individual's quality of life. So when you have been empowered, it is also important that you empower the community with information so that they are able to understand how to effectively manage issues of menstruation. Engaging in sustainable income generating activities is also another important thing so that individuals are able to afford menstrual products. All these things might be attached to an income level. You might have to part with a certain amount of money in order to purchase a menstrual product. So if you can empower individuals with income generating activities, then the chances that they can afford these menstrual products is very high. Advocating for gender equality, dismantling menstrual stigma, and promoting inclusive policies and practices. And this can be through advocacy, this can be through policy. Governments and policymakers can come up with policies that help streamline discrimination as a result of the menstrual stigma. especially in our societies. But also, advocacy can be through our various social structures, which include the traditional leaders, our religious leaders. All these structures are very important if we are to address the issue of the menstrual poverty. Managing menstrual symptoms including cramps, bloating, the mood changes, and fatigue that accompany menstruation is also very important if we were to address issues of menstrual poverty. But this is through empowering people with knowledge, most importantly. Uh, Seeking appropriate healthcare support and managing symptoms with medication, therapy, exercise, and self-care practices can promote overall well-being. Right here, this photo is just showing a young lady going through a menstrual period, and as you can see, she's holding her lower abdomen as a result of pain that could be because of the cramps. But these are pains that should be managed, and management involves using just a light remedy that may slightly reduce the pains that occur, including drinking warm water. Sometimes individuals do cooling of the tummy by just uh, putting water or towel into a warm water, and then you move it around your abdomen. It is important that communities understand some of these management processes. Uh, the psychological well-being, menstrual symptoms, and the hormonal changes impact individuals' psychological well-being because because of the secretions because of the secretion of the thin lining that comes with a lot of pain. It also comes with hormonal changes. Hormonal changes because, as we saw earlier on, that before menstruation takes place, that there are hormones that are being released onto the body because they expect a potential pregnancy. And as a result, this is how the hormonal changes occur, and therefore these have impact on the brain of an individual. And someone may have mood swings, but what is very important is that management of this can be done. Open communication with partners and healthcare can also help us address any concerns and find strategies to support, especially the mental and emotional well-being. Through healthcare providers and your partner, you may be able to have an emotional support, possibly which can help mentally, possibly through also counseling. Menstrual counseling could help individuals overcome the mood swings. Some individuals may experience menstrual disorders such as heavy or irregular periods. Now, but also they can experience severe pain, dysmenorrhea, or the absence of menstruation, which we call amenorrhea. But these conditions may require medical evaluation, diagnosis, and appropriate treatment to address underlying causes and improve sexual health. So, when you experience irregular periods and sometimes you have heavy bleeding, it is very important that you seek medical attention as fast as possible so that this is understood. Seeking support and care, uh, individuals experiencing menstrual disorder or significant disruptions to their menstrual cycle should be able to seek support, which we have just said. Health providers can offer guidance, diagnostics, tests, treatment to manage these conditions. Social and cultural aspects of menstruation. Menstruation carries social and cultural significance in many societies. Many cultures have taboos, myths, and stigma surrounding menstruation, and this can lead to shame, isolation, and limited access to resources. You very well know that in the majority of our societies out there, our cultures have taboos. You may even be knowing some of the myths that are surrounding menstruation. We already had the other day I said in some of our cultures, a girl starting to experience menstrual flow is considered to be mature and therefore ready for marriage. These are some of the myths that are associated with menstruation, and therefore someone may feel they are still young, or they would want to continue studying, and because the society has a myth or that when you start having this, you may be mature, an individual may start to isolate. Addressing menstrual equity and promoting awareness can help ensure women's rights and dignity. Now, breaking myths and promoting positive attitudes is all the very important role we must be playing as individuals, so that we can help eradicate myths but also misconceptions. Now, debunking these common myths includes or involves educating individuals about the natural and healthy aspects of menstruation. Individuals need to understand why menstruation occurs, and it is very important that when an individual has this information, they will be able to react accordingly, but also not negatively. They will be reacting positively on menstruation. Encouraging open conversation, providing accurate information, and fostering supportive environments can also help in breaking the societal myths. Maintaining a healthy diet with balanced nutrition, including foods rich in iron and essential nutrients. Uh, the other time, I can still give this that the gentleman who was asking for the role of nutrition in sexual health, it is very key that you understand that a healthy diet is very essential in managing menstruation. Healthy diets, exercising regularly, and paying keen attention to your lifestyle will help in managing the symptoms or the pain or the symptoms that occur during your menstrual cycle. So it is very important that we promote. It is very important that we promote healthy diet, regular exercising, avoiding stress or managing stress, but also practicing self care. It is very important in supporting an individual's menstrual cycle. When you eat a diet that is rich in iron, including meat, many people claim that they may not want to eat meat, but studies have shown that meat is very important, and it helps in reducing some of these pains also. Those are studies where we are saying uh, ladies shouldn't use it as a reason to ask the man to buy meat all the time during their menstrual cycle. But we're saying as a lifestyle, you need to have a balanced diet of nutrition so that you're able to avoid the mood swings and the impacts of menstruation. Resources and support for menstruation. We need educational material, and our websites are providing a lot of information on menstrual health. So it is important that you refer individuals to such websites, especially young people who are able to access online or digital systems. You can be able to get a lot of information on sexual health on different websites, but also on educational material like the one we are providing today. Menstrual health programs and initiatives yet another resource that we have to accessing menstrual products. There are many menstrual health programs that are occurring in very many societies today, and some of them include empowering girls, and many of these programs help in providing affordable or free menstrual products. There is also availability of accessible menstrual products and services in various settings, and there are support from organizations, helplines that are offering assistance and information on menstrual health. And many, for example, in Uganda, they have helplines where an individual can just call, and they start. It is like customer care. When you're calling your telecommunication company, they will put for you some messages. Some messages are advert messages, they are talking about their products and so forth. So there are organizations that are supporting this through these helplines where they call. When you call, you're able to access menstrual health information, but also you're able to access some support and care from the individuals that are online. Human rights and gender equality. We can realize that throughout our sexual health, we've been able to encounter human rights. And now we're relating today human rights and the aspect of gender equality. Menstrual health and hygiene are human right issues, and addressing them is crucial for achieving gender equality. So, if we want a society where women also feel they are part of the world, it is very important that we treat menstrual health as a human right, but also as a normal thing, so that women can feel they are also part of the community, and that can help in promoting gender equality, promoting dignity, privacy, and inclusivity in menstrual health and hygiene initiatives. It is very important that privacy and dignity are, are included in menstrual health, because these are human rights. Privacy and confidentiality of information are very critical in trying to achieve gender equality. We need to advocate for policy changes that recognize menstrual health as a fundamental right and challenge discriminatory practices. Very many discriminatory practices in the community, but also we have a lot of social stigma in schools regarding menstrual health. So it is important that we advocate for policy that could help recognize our menstrual health as a right, and then reduce the social stigma. Evidence-based practices in menstrual health include comprehensive menstrual health education. This is very key in addressing menstrual health issues. We need to provide accurate information, debunking myths, and promoting positive attitudes. We discussed this principle earlier on already. We need integrated service delivery. We need to integrate menstrual hygiene into our daily offer services, the daily services that we offer. For example, if you're going for an outreach in a village, if you are going for a family planning outreach that is targeting young girls or adolescent girls or what, it is very important that you also uh, integrate the issue of menstrual health in that particular package of family planning outreach that you're taking. If you're going for if you're going for your education or a education tour or what, it is very important that you integrate issues of menstrual hygiene That is how we can continuously improve menstrual health in our society. We need to continue to engage communities and stakeholders so that they can design programs that uh, that look at menstrual health also, but also they can do menstrual health specific programs so that these issues in the society, including stigmas, are addressed. It is also important that we monitor and evaluate menstrual health programs. Now, collecting data to assess the effectiveness and the impact of interventions and inform future strategies is very, very important in project management. Uh, for example, any interventions that are being done, which include a provision of free sanitary material, it is very, very important that we assess or we monitor and evaluate through collecting information from the end beneficiaries of such programs so that we understand what is working and what is not working, and then we're able to inform decision. Designing a project or campaign, we need to identify the target group. Now, this is more of giving you information so that if you are looking at developing a project or an intervention regarding menstrual health, these are the key steps you should take if you want to design that intervention. You need to identify your target group, and you can identify this through the specific needs and challenges faced by each target group. If you were looking at young adolescent girls, you need to understand what are the specific needs of young adolescent girls and what are their challenges. Then you're able to come up with a target specific intervention. You may struggle to intervene if you do not understand the target group and their specific needs. You may go to a community that believes that a woman is not supposed to have a menstrual cycle at the age of 16 or so. And then if you go there with a target and start distributing to girls who are below that particular age, you may realize that your project does not make any sense to that community. So it is very important that you understand your study group and your intervention group so that you do not intervene against some of their beliefs. You need to engage the community in the planning process. It is very important, and even in the implementation process, because if you brought individuals from somewhere else to implement a project for a community, the community cannot own it. They may not own the project. In Uganda, there was a famous project in a region. There is a region in the country called Karamoja. The Karamoja region. It is northeast of the country, and it is predominantly occupied by the Karamojong uh, sect. So an organization went because they were predominantly in their community. You do not defecate in an enclosure. So for them, you have to defecate outside, and it is part of their cultural uh, their culture. It is part of their culture, and therefore, a non-government organization went and constructed toilets for the community without virtually involving or identifying what were their specific needs. And the project did not succeed because these people were wondering how they could construct such nice buildings uh, just for you to go and defecate. So it was all amazing for them, and they just left them there, and they said we can't defecate in a house, and they continued using their bushes. And then you need to incorporate education, product access, and infrastructure development into designing a project. You also need to empower individuals to become advocates and agents of change. We've had different projects that are now using youth peers as agents of change, and this is a very important uh, method or way of trying to reach the community. When you choose agents of change within the community, then the community is able to borrow a leaf, or they will be having what they call role models in the community, and therefore any reference is being made to the role model, and therefore they will feel this is one of us, and therefore they are able to change, because then if one of them has changed, then it is also important that they take the good lessons of one of their change agents. How do you assess feasibility and sustainability of a menstrual health intervention? You need to evaluate the availability and suitability of menstrual products. Uh, you need to also look at how available are these products, how easily accessible are these products. You may want to start an intervention on giving sanitary materials, but when you do not know the availability of these products, you do not know where these products come from. So you need to evaluate this very critically, but also you need to be innovative in the target population. If you realize that, for example, in a in in a project that was targeting condom distribution for men, they realized that they used to put the condom corners in health facilities, and people were not picking them. Boys or men would fear to openly go and pick these condoms at the condom boxes. So one of the organizations realized this as one of the challenges, and as an innovation, they decided that around the community, in the night, they will go and place the box in on one of the trees that is just around the community, and all of a sudden, if they could place a packet of condoms around there, people would, in the morning, you would come and you would not find them. Unlike when they were in the hospital, unlike when they were in the open where everyone would see you going to pick a condom, this innovation literally worked. And then they continuously kept accessing condoms. So it is also very important to be innovative when you are assessing feasibility of an intervention. Consider the socio-economic and environmental factors that may impact the sustainability. How sustainable do you think the project can be? Many of the societies today, or they may not be regularly buying a menstrual product, but you may not also have resources or the budget outline to fund provision of sanitary material throughout your lifespan as a project. So what is key is for you to identify a sustainable product. We have seen individuals who have started using reusable sanitary pads, and many individuals have been empowered on how they can make these reusable pads. This is sustainable because in the long run, it is cheaper. You need to ensure long-term engagement, collaboration with local stakeholders and organizations as well. Collaboration is very key in interventions. Advocacy for the inclusion of menstrual hygiene. You need to when you advocate for menstrual health and hygiene, and then we know that policy and budgets, but also public health agenda would be directed onto menstrual health. So the advantage of advocacy is that it can influence planning, and it is very important that governments, but also NGOs or community-based societies, organizations should be able to prioritize menstrual health hygiene. So you need to advocate for menstrual hygiene, and you also need to collaborate with policymakers to raise awareness and drive change so that policies are formed, policies that are inclusive can be formed in order to improve menstrual health uh, among the society. But how critical can you collaborate with policymakers? You can collaborate with these policymakers through showing for them the picture of the ideal through education. You must educate these policymakers on what is the actual ideal that is supposed to be and what is the situation in the communities. You who works in the community, you should be able to understand the challenges the community is facing and then present it to policymakers so that we are able to raise awareness and drive change. Highlight the importance of menstrual health as a key aspect of overall health and well-being, so that individuals understand that menstrual health is actually very important in the lifestyle of a woman. What are the professional skills and competences in advocating for inclusion, but also for menstrual health? It is important you have effective communication, and effective communication can only be done if you're well educated with issues of menstrual health. Now, engaging with diverse stakeholders and tailoring messages to different audiences on menstrual health can help in advocacy. So it is important that your information is straight and it is tailored to a particular audience. For example, you cannot design messages for people in a society that may be predominantly less educated. You tailor messages in English rather than the community language, rather than the local language. It will mean that your message is not effective because your target group is different and you're tailoring message that they cannot understand. You may not you may not tailor information to young children by just writing plain statements like you're seeing here, and you may not have to use long statements or long sentences to explain to a target group of children because they will read and get bored because it is boring. So it will be important that you draw their cartoons that are talking, or you draw their some individuals animated figures so that it attracts their attention. That is how effective communication can be. But also, you need a collaboration and networking skills if you're to do advocacy on menstrual health and inclusion. You need to build partnerships and foster collaboration so that your yard or your area of argument is broadened. When many people understand the situation and start to advocate as a group, the chances that you may be able to be heard are higher, because there are different people who are advocating for the same.
Hello, having problem with my network. Oh, we have lost the presenter.
Maybe it's off for a while. Let's wait for him to come back.
Need collaborators, or you need to build a group. Most times we've seen some organizations that have formed groups so that they can advocate for certain issues in a collective manner, and it is very important, but it is also a competence in advocacy for menstrual health. Cultural sensitivity is very, very important, because majority of the issues that affect our society are because of our cultural and religious practices. So it is very important that in developing intervention for menstrual hygiene, or in trying to advocate, you understand that individuals have different cultural beliefs, individuals have different backgrounds, so that it is very easy for you to design an intervention. And it will be very important that when you're deriving an intervention for per se, let us say for these specific uh, interventions, especially on menstrual health, it is very important that you understand that this community might be having a different thought, or maybe having their own belief system on on menstrual hygiene. So when you're developing your intervention, you have to be very critical and sensitive of such communities. Now that brings us to the end of menstrual health as a concept in this module that we're studying. From yesterday up to today is the conclusion of how we can effectively manage menstrual health, from explaining and understanding what it is to how we can intervene and help the society achieve a better menstrual health. So let us use this time, since we have also exhausted the 1 hour that we were supposed to use. Let us use this time, the remaining minutes, to ask if there are any questions